It's my pleasure to introduce Dean Lefebvre. Dean graduated from the University of Saskatchewan with a Bachelor of Science degree in anatomy and attended SciAst in Regina, where he obtained his diploma in dental hygiene in 1996. After graduating from SciAst, Dean worked full-time in private practice, started up his own mouth guard system, and taught a variety of classes at SciAst. Dean started working full-time at Saskatchewan Polytechnic in the dental hygiene program in 2009, where he educated dental hygiene students on preventive dentistry, radiology, community oral health, and clinical dental hygiene. Dean taught local anesthesia to dental hygienists, requiring this designation to practice within Saskatchewan, and has developed courses to help retraining dental professionals. Dean is now the program head of the dental programs at Saskatchewan Polytechnic. He's a surveyor for the Commission on Dental Accreditation of Canada and item writer for the National Dental Hygiene Certification Board. He also serves on the Academic Progress Committee, Health Sciences Interprofessional Development Committee, and Instructional Leadership Development Advisory Committee. Dean obtained his certificate in adult education and training from the University of Regina in 2014 and completed his master's in adult education in 2019. Dean has been involved in the Saskatchewan Dental Hygiene Association, Canadian Dental Hygiene Association, conference committees, and other group organizations. He has spoken at provincial and national conferences on a variety of different topics. Dean has initiated a number of community oral health initiatives within Regina, including implementing a brushing and sealant program at Mother Teresa Middle School, participating in community oral health fairs, and most notably Dental Day and the Northern Dental Day, now called Health and Wellness Day. Health and Wellness Days. Dean actively promotes and supports interprofessionalism within his profession and at Saskatchewan Polytechnic, and encourages his students to do the same by coordinating interprofessional activities for them. In 2018, Dean was awarded the Faculty Award of Excellence in Teaching at Saskatchewan Polytechnic, and in 2022, the Canadian Dental Hygienists Association Award of Merit.
You want to tell him he's on mute?
Thank you, everyone, for that introduction. I appreciate that. So I just want to acknowledge that I am reporting from Saskatchewan Polytechnic Regina campus, located on Treaty 4 territory and homeland of the Métis people. So I'm happy to share the experience that we had here with our Northern Health and Wellness Day and share with you some insights on some exciting things moving forward here. So our Health and Wellness Day, it occurred October 14th and 15th, just this past year, so just about 3.5 weeks ago, in the communities of Buffalo Narrows, La Loche, and Clearwater River Dene Nation. So first of all, why did we choose these communities? Well, we looked again at the research and kind of followed the dental hygiene process of care of understanding, you know, the areas that required the need for our outreach. And again, according to the Canadian Oral Health Framework in 2012, Indigenous people, they do suffer decay rates 2 to 3 times greater. And when we looked at even some of the Saskatchewan Dental Health Screening Report that was available at the time, they did report the highest decay rates in Canada up in northern Saskatchewan, and this related to about 2 times the amount in Regina alone. And they also were not accessing dental care as readily because of all the barriers that they experienced within those communities. So just looking at, you know, the communities of Buffalo Narrows, La Loche, and Clearwater River Dene Nation, they are, you know, a little ways up north, and the population has relatively stayed the same in the last 5 years since we first initiated this research and confirmed the data that drove us to that community. We did realize as well too that there's a lot of people within the community that speak the Dene language. So having a good understanding of that and making sure that there were some interpreters around if there were any language issues. And what was really interesting too is that in La Loche and Clearwater River Dene Nation, they do have health clinics there that provide a variety of different services. And this is kind of why we looked at providing an interprofessional approach. So we weren't just thinking about dental care, but overall health as well, and support some of the workers that were up there, especially over the last few years here where COVID has had its toll on those workers as well too. Then we also, consider too the grocery store, and we were able to bring our students through the last 2 times that we were there, just for them to have a better understanding about food security and food costs, because those have risen, as we all know, as a result of the pandemic as well, even more so up in the north. Truth and reconciliation calls to action. So the 3 that I have highlighted here are important considerations as well too on why we need to do this work. So if we are wanting to act again on these recommendations that were given, we do need to increase the number of Aboriginal professionals working within the healthcare field. And this includes dental as well too. And that's what's really exciting about our dental therapy program that we are implementing here in the fall. But bringing the students into these communities to show them a little bit about our profession and what our profession is all about will hopefully inspire them to apply into the programs and then go back into those communities to share their skills and knowledge to make the communities a better place. Also providing cultural competency training for our healthcare professionals. The individuals that we saw when we were up north are not typically the same individuals that we would see in private practice, especially in the larger centers, because again, the access to care issues that they encounter, and of course, financial being a big one for them as well. So we first started this project in 2018, and you can see our team there was a lot smaller than our most recent team in 2022. We did take a little bit of a break there from 2020 and 2021 just because of the pandemic. But we had 22 volunteers, and even at that point, even when we called it Northern Dental Day, because our focus was dentistry at that point, we still had a little bit of interprofessionalism mixed in there with the nutritionist and nurse, as well as some other members within the Saskatchewan Health Authority and NEITH, Northern Intertribal Health Authority as well too. So over that 3 days, we saw 94 patients and completed just over $26,000 worth of dentistry. Fast forward a year later, you can see the team getting a little bit bigger, and this is where we called it the Health and Wellness Day. And we had, a nice mix of as well, and this is where we brought up nursing students as well as dental hygiene students, just to provide that outreach with the general health approach. And that year as well, we completed quite a bit of work, but I'll focus my attention here on this year's event, and that was 60 volunteers, so quite a bit. And you can see the list there. So we had a mixture of dentists, dental therapists, hygienist assistants, dental aides, as well as dietitian, registered nurses. And this year in particular was a little bit different because we brought up the dental assisting students, which was really exciting for them to see the profession, because they just started out in this program in September. So they're really excited. And I still remember one quote from one of the dental assisting students that said, "This is why I got into the profession. This is what I want to do." So when I go back to those calls to action for truth and reconciliation again, and we think of our responsibility as experienced dental professionals, we have to pass that knowledge on to that younger generation, and hopefully they can carry that torch and do some of this work in some other communities and be inspired to do more than just clinical dental work that we all know about. So of course, this could not happen with not only the volunteer group that we had, and we actually had to turn away some volunteers just because of capacity issues, but our sponsors. So Cameco, SUN, Saskatchewan Union of Nurses, of course, Saskatchewan Oral Health Coalition, I'll give a call out to this organization, Saskatchewan Dental Therapy Association. They did give a financial contribution that helped cover a lot of the heavy costs that we had to endure to run this project, and I'll share that with you. Saskatchewan Polytechnic, they offered the lunch for our volunteers when we departed from Regina, as well as swag for our volunteer bags. Saskatchewan Health Authority provided free lunches on site, as well as some morning snacks for our volunteers to make sure that they had the nutritional support that they needed to carry out their work. And you can see a number of the dental companies here: Cable Cur, Dent Supply, Premier, Septodon, 3M, Medicom, Vista, NSK, SciCam, Voco, Pulsar, and Oral Science and SDI. Without them and the sponsorship of the dental supplies, we would not be able to deliver the care. And call out to the Saskatchewan Dental Hygienists Association for help in planning this, specifically Alyssa Boyer, who did a lot of work for us with our volunteers, as well as them allowing us to use their office as a drop-off and pickup point for equipment, supplies, and volunteers. So talking a little bit about the equipment and supplies, this was very critical that we, had the equipment that we needed to carry out our work. So a shout out as well too to Leslie Topola and the Saskatchewan Health Authority, specifically in Saskatoon, that allowed us to use their portable chairs and compressors. Same thing with Megan Couture and the Indigenous Services Canada branch within Prince Albert that provided those portable chairs and compressors as well too. And they had a person there waiting for us to be able to pick up those supplies as we were passing through Prince Albert on our way up north as well too. And then Buffalo, Narrows, and Clearwater clinics that each had a portable chair that we were able to use in those locations. So Cable Cur allowed us to use a Nomad handheld X-ray unit, which was really beneficial to be able to take the radiographs and not be confined to a particular chair that had an X-ray unit. So we were able to take radiographs and be able to assess things ahead of time. We did bring 4 DEXA sensors from our school here at Saskatchewan Polytechnic, as well as 1 Schick pitot sensor to be able to take radiographs quickly on our laptops at each of the locations where we were providing care. Want to give a shout out as well too to Shane Weidman from Sinclair Dental, who did a lot of great work for us as well. And he actually joined us on this trip. He did in 2019 as well. So he does, have the ability to fix things, which was put to use more often than not, especially when we are putting things together and working out of spaces that typically weren't dental clinic spaces. He also was able to secure a couple of Statum sterilizers because, again, where we were delivering some care was not, an area where there was sterilization available. So we were still able to maintain asepsis and prevention control measures wherever we provided the care to the communities where we were working. So just to cover a little bit of the costs, and then I'll go into the details of how this project came to be. So we did rent a bus, which again made the trip much more comfortable compared to the first year in 2018 where I was driving a rental van and having everybody pile in. It also allowed us to have the space to carry a lot of the equipment, supplies, and food that we needed for this event. Accommodations and food, you can see there that came to about $20,000 alone. And then t-shirts, photocopying signage, and dental supplies. So I'll mention too that St. Clair and the work of Shane, by reaching out to the suppliers, we were able to get the dental supplies for about you know, $2,400, and it was over $15,000 worth of supplies that we had. So in total, our budget was about $28,000 for this event. So where we delivered care, specifically the LaLoche and Clearwater Health Clinics, as well as 2 schools. So within the LaLoche Health Clinic, where they provide emergency care as well as acute care, mental health services, and they have senior care beds, 8 senior care beds. It was great to incorporate nursing in with this as well too, because of the fact that it's a one-stop shop health clinic that also has 2 dental chairs within the dental clinic. We did convert 1 conference room and the spiritual center into dental treatment rooms with our portable chairs and compressors. In the one on the right here, that is the Clearwater River Dene Nation Health Clinic. And again, that's about 11 kilometers north of LaLoche. There was 1 dental chair in the clinic there, and we utilized a conference room where we set up portable chairs as well in those areas. So the community schools that we worked out of specifically here are the bottom 2. So the Clearwater River Dene School, the reason why I have that picture up there is as we were setting up on Friday, our students, the nursing, dental assisting, and dental hygiene students were able to present Friday morning to all the grades. So it's a K to 12 school with about 250 students, and they were able to do a variety of presentations that I'll talk about a little bit later. Ducharme Elementary School here in the middle, that one there has a dental chair, and we also set up 2 portable chairs in the gymnasium since school was not going on at that location when we were there on Friday. So that was good timing as well. And Buffalo Narrows Twin Lake Schools also was out because there was teacher professional development. So that school in Buffalo Narrows has 1 permanent dental chair in their dental clinic, and we were able to use some adjoining office space to add some portable chairs as well. So how this journey started, we boarded the bus here at Saskatchewan Polytechnic Regina campus on October 13th, which was a Thursday at around 12:30. Lunch was provided on the bus for everyone that was being dropped off and boarding the bus here in Regina. And then we made our way to Saskatoon at the Saskatchewan Dental Hygiene Association office, where we picked up some equipment as well as food and supplies that Shane was able to secure since he's based out of Saskatoon, and then also more volunteers. So those were the 2 pickup locations. We also had a spot in Prince Albert for anybody that needed to be picked up in that location, but everybody was picked up at Regina and Saskatoon, and we basically just stopped at Prince Albert at the ISC building to pick up the portable chairs and compressors. And then we also picked up pizza at the ISC where we had it delivered in Prince Albert so that the volunteers could have supper on the bus as we made our way again up north. So you can see there's a little bit of distance that we had to get up here to northern Saskatchewan. So again, a long journey requiring some creative packing. So you can see the swag bag the volunteers got, which included, you know, a little survival snack kit with granola bars, gum, and the water balls. We had face masks in there. We brought rapid tests too to make sure people were safe on that journey as well too. And we did have some people go down that tested positive ahead of time, and we had to make some adjustments on the fly. We had a t-shirt in there as well too, and an information package telling volunteers about the day and some paperwork that they had to sign for the Saskatchewan Health Authority and consent release forms for photographs to be shared. So you can see this is the picture taken here at the Saskatchewan Dental Hygiene Association office where they were storing some of the equipment, where again everybody was able to jump off the bus and grab this equipment and load it up. And you can see me in here in this middle bottom picture here just being creative and trying to find every space, and we did kind of have a little bit of anxiety with this because of the fact that, you know, space was tight, but we were able to fit everything in there safely. So thank goodness for that, because we didn't want to leave anything behind. And then here, this bottom right picture is us arriving in Buffalo Narrows at our accommodations and starting to unload the bus. at that location. So that was around 9 o'clock, quarter after 9 at night. So our 3 locations that we stayed at in Buffalo Narrows was Crow's Nest Inn. We had about 26 people there, and then we had people staying at Bayside Guest House, another 25 people, and then 9 people staying at the Churchill Lake Guest House as well. So the accommodations were fairly close to each other, which made it convenient for us to pick everybody up and then get on our way. And along the way, of course, too, this is what it looked like as we were traveling. One highway going up north, and of course, like there was a couple of us helping the bus driver out up front there because we counted about 22 deer that were along the ditches here, and there's a couple up here as well too that we just had to be aware of. We did not see any bears this time, unlike our previous 2 trips up there, but that's not a bad thing either. But you could just see some of the beautiful scenery that we had here. So this was a shot from our accommodations here, and one of our volunteers fishing on Sunday morning, which was a free day for people to enjoy and take in the scenery. And then this is just on the back side here, this bottom left picture on the back side. And this was a great picture because this, where my arrow is right here, is an elder that was sharing some knowledge with a lot of our volunteers. And this was just on the back side of the LaLoche Health Clinic. So it was very beautiful up there. It was actually nicer up north than it was in Saskatoon and Regina at that particular time of year. So what was different with this one in 2022 is that we offered care in Buffalo Narrows for the first time. The previous 2 times we delivered care in only LaLoche and Clearwater. So Buffalo Narrows, they also have, again, within the Twin Lakes School, 1 permanent chair with an X-ray unit, and then we brought a sensor and placed that in there, and then we added 3 more portable chairs. So you can see we had a dentist, a dental therapist, a hygienist, 2 assistants, and sorry, that's a repeat there too. So we actually had 2 hygienists in this location as well too. In LaLoche, we had a total of 7 chairs, including the existing and portable chairs that were added, and we had a mixture of dentists, therapists, assistants, and hygienists in that location. And at the Descharnes School in LaLoche, there again was 1 existing chair, and we added 2 more portables in the gymnasium there. And that's where we had a dental therapist and a couple hygienists and an assistant working. And then at Clearwater Clinic, they have 1 existing chair, and we added 4 more portable chairs in their conference room, and we had the dental team working there as well too. And I should mention as well too, at each of these locations too, we did have nursing students as well as dental hygiene and dental assisting students. Once they were done presenting on Friday morning, they were at these clinics to provide education. They provide childcare if required for parents that were receiving care, as well as providing general education information for the clients as they were waiting. And they were able to do health history screenings and blood pressure screenings for us as well. So they did a variety of important tasks to help support the work that we were doing at each of these locations. So here are the students here presenting on Friday. So again, 8 nursing students from Saskatoon, Saskatchewan Polytechnic, and the University of Regina Collaborative Program. 4 dental hygiene students from our program here in Regina, 3 dental assisting as well from our program. And you can see they did these presentations at the Clearwater River Dene Nation, where it included topics such as self-esteem building, Be Kind of initiatives, oral and general health information, which was really well received, and a lot of interactive activities for the students. So it was a great way for the students to learn a little bit more about each other's profession and work together in this interprofessional environment. So a little bit about the process of care. So patients arrived first come, first served, and they registered at a desk at each of the locations that we had for each of the communities. And then assessments were done on site, whether they needed radiographs or checkups or screenings, and then it was determined what work could be done, right? So we try to do as much work as we can, but also make sure that we were containing that work within an hour and a half or 2 hours so that we were seeing as many people as possible. So obviously we couldn't fix everything, but we tried to prioritize and see what needed work the most according to the practitioner as well as the patient of what their needs were. So hygiene education, we did use silver diamine as well too, thanks to Oral Science for donating that, because any work that we could use that product on to slow the decay process, we of course did that, and extractions and restorations as well too. So after the event, so we basically provided care on Friday afternoon. So when we arrived Thursday night, it was basically just getting everyone settled within their accommodations, the 3 locations. And then on Friday morning, we woke up bright and early, loaded the bus by 7:30 because it is an hour drive from Buffalo Narrows to La Loche. And that is where our volunteers that stayed in Buffalo Narrows, they were able just to relax at the resort and have a coffee and a muffin while the rest of us traveled that 1 hour to get up north. The students presented on Friday. We set up at each of the locations on Friday morning, had an opening ceremony by 1 o'clock, 12:30, 1 o'clock, and then started to provide care about 1:15 and worked until 6 o'clock that night. So we were able to get as much as we could done that day, but knowing that Saturday would be our bigger day. So Saturday again, woke up. We were on the bus by 7:30 to be up at each of the locations, especially up north, to start providing care by 9 o'clock, and we worked until 5 o'clock, and then basically had to tear down because that was our last day, and then also get ready to come back home on the Sunday. So Sunday was an open day for anyone to just sleep in, relax, take in the scenery, do a little bit of fishing, canoeing, kayaking. But on the Saturday night, after we had finished the last day of care, we had the meal catered by a local company where they did fresh fish for us. So we had a fish fry and a social, and you can see the students and one of our dentists, Dr. Dean Zimmer here, playing some cards, and just a lot of networking and collaboration and fun was had by all, because a lot of these people didn't even know each other, and it was like they've known each other for a while because of the time that we got to spend together, not only in the bus but also in all of the clinics. And then Shane entertained us there with some fancy bartender drinks, so it was definitely a good time had by all. So a lot of great memories that we had at this event. Again, we saw 167 patients and did almost $85,000 worth of dentistry in the 2 days that we provided care on the Friday and the Saturday. Wish we could stay longer. But again, just the fact that the travel was a long period of time, you know, looking at about 9 hours, we had to make sure that we were getting back at a decent time. Unfortunately, as we were passing through Saskatoon, we did experience a flat tire on the bus, and that delayed us a little bit more in getting home. But yeah, so we got back to Regina eventually at around 9:30 at night on the Sunday. So just being respectful. And part of the advantage too of leaving on Thursday at noon from Regina is it still gave people the half a day. I know for us at school to still have classes, and the dentists that were volunteering and joining us from Regina, they could still work that morning. And then the ones in Saskatoon, because we picked them up at around 3 o'clock on the Thursday, they were still able to work for most of that day and not lose that production or have falling behind in any other commitments that we had to have. So here's a bunch of our volunteers that were just relaxing, having a snack break after working for a little bit. And I really like this picture here too, Dr. Holly Dunlop working with one of our dental assisting students, showing her some of the procedures that she's doing. So I know that the students really appreciated that experience, and it's going to bode well for them in their learning within our program, because they've already seen this, right? So it's great, and hopefully again inspire them to get involved in some of these outreach projects. you can see some of the good work that was done here by our dental therapist. And again, some of the beautiful scenery that we had up there too. The Northern Lights were dancing on the Friday and actually the Thursday and the Saturday. So we were able to capture some pictures of that. And then, just again, the fact that there's so many large water up north that we were able to take in and take it down. Beautiful scenery, the sunsets and the sunrises were just breathtaking. And here you can see a couple of nursing students as well as the nursing instructor going out for a little canoe ride to take that in. So we did have a media release and that just came out a few weeks ago, just shortly after our event. So I have the link on there too, and I'm sharing these PowerPoints for anyone that does want to access them. Lena will have that. But we did get some good media coverage. Again, just to acknowledge the good work of our volunteers, and this was sent out to all the associations as well to acknowledge, because we did have individual pictures of all the different professions so that they could be acknowledged for the work that they did, sharing their skills and knowledge, as well as acknowledging the sponsors, because again, without the volunteers and sponsors, this would not happen. Some of the challenges that we did experience, again, with us not doing it since 2019, it's amazing how often you forget sometimes on things and never can really plan for everything, but we knew again that space would be tight on the bus, so we did ask all the volunteers to just bring a carry-on bag with them because we knew that we needed that space underneath the bus to be able to house all of our equipment, supplies, and food for the couple days that we were going to be up there. So they were great, and again, we had to use some creative packing, but we were able to squeeze everything in. And then the excess food as well too was used. It was brought back and it was used here. And Alyssa did a great job of making up some food hampers and distributing it to the local charities in Saskatoon to make sure that that food did not go to waste and it was utilized as well too by people that could use it. So the 3 different locations, it did provide some challenges in the fact that we were all split up, but again, there were no other choices because of the capacity limitations that we had. It would have been nice to have some more transport vehicles to go between the locations, and being an hour from Buffalo Narrows to La Loche did create some challenges just because of that travel time. So to go there and back, you're losing 2 hours just on travel. But we did see a lot of patients out of that Buffalo Narrows, which we weren't sure about with it being the first year of us delivering care out of there. So we definitely think that that was worth it. And of course, it would always be nice to deliver more care and to stay there longer. So, we think about that with thoughts moving forward and how we can be more efficient and look at ways of, delivering care. But I also have to be cognizant of my volunteers because it's long days. I know there are some people that were having little naps on the bus ride home because they were really long days, getting up early and coming home late. Like we're eating supper at 8, 9 o'clock at night, especially if you're coming back from the La Loche and Clearwater clinics, because it did, again, take a little bit of time in getting back and getting stuff back onto the bus. But thoughts for the future, we do have feedback forms that are still coming in from our volunteers that we will review, because that again provides us with important information on how we can make this bigger and better each and every year. But essentially, this project is dependent on funding. So Cameco, they did, this was the last year of a 3-year commitment that they had. So we're hoping that they're able to provide additional funding moving forward, because again, $28,000 to go up there is really expensive, but it is necessary work. And that when we think of almost $85,000 worth of dental treatment, that does not include the amount of money that we saved the Saskatchewan Health Authority, as well as the Northern Intertribal Health Authority, as well as Meadow Lake Tribal Council in transport costs of getting these people to you know, other locations, paying for their accommodations, lost school hours, lost business hours. So that could be thousands and thousands of dollars more. We of course would like to expand into other communities like Gilacross and other areas around Saskatchewan that definitely could benefit from having us come into their communities to provide care. And that's one thing I've learned over the years is with community oral health, you have to go to them. You can't always expect them to come to you. We would like to expand into professionalism and offer even more services and provide, you know, more specialists and more care within these communities. And I'm not even thinking of only healthcare, but also bringing construction services and bringing, you know, counselors and a whole variety of teams into these communities to provide more than just healthcare. And then what's really exciting is our event here in Regina. We did set a date here, so it is on April the 1st of 2023. It's hard for me to say that, knowing how quickly the time is flying by here. So our focus has shifted to our Regina event here at Saskatchewan Polytechnic Dental Clinic, and we're really excited to report that we have partnered with the Ukrainian Congress of Canada, the Regina branch, and we are looking at providing care to the Ukrainian immigrants that have been fleeing the war back in their home country. So there's 2,000 Ukrainian immigrants in Saskatchewan right now with really limited dental care, and we're really excited to reach out to them and provide care that they desperately need as far as oral health. And I just want to share with you, because this is why we do it, this is my last slide here, the patient testimonial. So we captured a patient testimonial. We are doing a video montage here as well too. So our audio visual department is still working on this, but I had them put this together so that I could share this patient testimonial with you, because this was one of the last patients that we saw on Saturday, and again is the reason why we do what we do. So I'd just like to share this video with you.
Marianne Guthrie. I grew up in the lodge until I was about 12 years old. And then my parents had moved me across the lake. It's called Black Point. We have a roof now. And I've lived there until today, since 1982. Became a parent as I was growing up, and I raised my children there until today. I still take care of my grandkids. This morning I just dropped them off at noon hour, and I found out I had to run here to get this done for me. I was so desperate to get this done for me because I had no income whatsoever. Well, I have my feelings done with cleaning and everything, and I'm so proud of these people and the chemical that came out that brought you guys out here. How do I say this? I don't have income, so I don't have no access to get my teeth worked on. So I tried every way to get help and assistance, and I think it's hard. So last year, my kids had to chip in money for me to get my front teeth done, which wasn't done this perfect. I was so proud of you guys.
That's good.
I never thought it would turn out like this. I'm grateful.
That's great. Yeah. Can you give me a little smile, and can I see those teeth? Excellent. They're beautiful.
Thank
Beautiful
you.
Teeth. And were they causing you pain? Like,
Oh,
were
yeah. They were cutting my tongue, and a lot of time, like I couldn't, like it just bothers me so much. It was giving me a hard time eating too.
Yeah.
Yeah.
And how are you? All right. Well, thank you for giving me this opportunity to share with you. And again, thank you very much to the Saskatchewan Oral Health Coalition for providing the support for this event.
Thank you, Dean. That was very, very informative. We really enjoyed that. And if you can send your mailing address to Lena, we'll send along our thank you to you for sharing your time with us today. Thank you. Thank you very much.
Take care, everyone.
Dr. Spafford is here.